Next tonight, campaigners are calling for more to be done to tackle the problem of Lyme disease in the UK.
There are claims that many thousands of cases of the disease, which is spread by tick bites, are going undetected. Their claims denied by the Department of Health, as Kevin Ashford now reports.
Kellie Maher has only just started to get her life back on track after years of living with the symptoms of Lyme disease, a disease she believes she caught from a tick bite near her home more than a decade ago. Until recently, she had to rely on a wheelchair to get around and suffered from extreme fatigue as well as joint and muscle pain.
Really weak, I can't move.
It was only after being seen by a doctor in Belgium that she managed to get a diagnosis and then treatment, which has transformed her life. Kellie has set up a group to try to improve awareness of the disease. Hers is one of the organisations behind today's meeting for MPs.
The amount of suffering that this can cause, you think you've reached the worst and then something else pops up. And we know that thousands more people are going to be infected with Lyme disease, and the way things currently stand, there is a shocking number of cases being missed or misdiagnosed, and people developing debilitating illnesses completely unnecessarily.
It can be a complex illness. The symptoms of Lyme disease can develop up to a month after a bite by an infected tick. Around half the time, the reaction is a bullseye-shaped rash. If treated early, it's harmless, but untreated, the symptoms can become much more serious.
No diagnosis? No diagnosis because
Demetrios Loukas is also a Lyme disease sufferer. He too had to go abroad before his condition was diagnosed and treated. The group he set up has just carried out research which suggests the number of undiagnosed Lyme disease cases in the UK could run into thousands, possibly hundreds of thousands.
We need a dedicated clinic set up immediately to look after those people, those patients that have fallen through the net. And I must make it clear that there are children suffering from this disease who also test negative, just as I did. It's just unacceptable. We also need funds to be authorised, to be allocated to the development of a new testing system.
There are a lot of people out there with conditions like chronic fatigue, fibromyalgia, psychiatric conditions, autoimmune conditions that may actually be infected by I'd call it the sort of signature agent of Lyme disease, and that's an organism called Borrelia.
However, the Department of Health disputes claims that cases are being missed. They say, unlike private laboratories, UK testing for Lyme disease uses robust, scientifically validated methods, and there's no evidence that large numbers of cases are going undiagnosed. The size of the tick population in the UK is said to be increasing, another factor likely to increase the number of diagnosed cases of Lyme disease in the country too. Kevin Ashford, ITV News.
Well, earlier I spoke to Joanne Baskett. She's a mum of 3 from Swindon who was bitten by a tick while on holiday in America. And I began by asking her when she first noticed her symptoms.
Well, it was 23 years ago, the first time I got bitten. And I've subsequently been bitten in 2009-10 in my own garden. I came back from being abroad in the States, and I felt very fluey, very unwell, but I did have like the bullseye rash on my back and on my arm, but I didn't think anything of it. I just thought that they were mosquito bites. I'd never heard of Lyme disease. I didn't, think that was a problem. So I came back, went to my doctor's. He gave me antifungal cream to put on the bullseye rash, and that didn't make it go away, and it sort of lasted for about 6 weeks. And during that time my health just started to go down. I just felt really, really, really exceptionally tired, like flu but 10 times worse.
And Joanne, how long did it take for you to be diagnosed with Lyme disease?
Only 2 years ago. An NHS neurologist decided to test me for Lyme disease, and I was like, well, what's that? And she said, oh, go home and just research it. So I did, and it was like an aha moment, because when I saw the bullseye rashes, I just knew that that's what I'd had, because they was exactly the same.
Joanne, just tell us the impact this has on your life.
Oh, it's been devastating. I lost my home, my job. I can't afford to pay for treatment. I have no family support. It's just me and my children. It's really tough, and it's ruined my life.
And Joanne, just finally tell us what needs to happen for you to get better.
Well, what we need in this country, we've got these guidelines that are being set, but that's going to be maybe next year or the year after. immediately we need acceptance of foreign tests, because they're at the same level as what the PHE tests are in terms of their accreditation, and we need a clinic ASAP, and we need specialists in to run that.
That was Joanne Baskett speaking to me a little earlier.